One of the issues that's coming up already in the news, and you're going to read a lot about it, is the repeal or reform of the Affordable Care Act, usually known as Obamacare. One of the signature achievements of the Obama presidency was to get a bill through that had originally two intentions. One, to cover more of the people that are uninsured medically in this country. We are the only advanced industrial country with the tens of millions of people that have no medical insurance. We are completely in the forefront in that regard. And this was a bill that passed and reduced that. Didn't eliminate it, but it reduced it. And the other thing it was supposed to do was to reduce the costs of our medical care. There would have to be called an utter and complete failure. It did increase the number of people that were insured, and that's certainly a valid and good thing that it did. It did not reduce the cost because it didn't go after the problem of cost in the medical care. And again, just to remind you all, we have, we have hospitals, doctors, insurance companies, and the drug and medical device producers. Those are the four industries. Together they comprise something we should be calling the medical industrial complex, right? The way we, with Eisenhower, learned about the military industrial complex. Well, we have a medical industrial complex. They work together, and together they make sure that the insurance covers the high prices of the drugs, and the high prices of the drugs make them look away from the problem of the high price of the hospital and the high price of the doctor and all the rest of it. And so they work together. They have their tensions among them, they do, but they also work together, which makes the United States also a pioneer. We spend roughly 18% of the total GDP in this country, the total output of goods and services, we spend on medical care. No other country on earth comes close to that. The cost of medical care in many other countries is half or less than that. Places, you know, remote places like France or England or Germany, Italy, those kinds of places that are clearly way behind us, where people are dying on the streets every day and only get to be 30, 40 years of age before they keel over, all of that. So we are a society that overpays, and that bill didn't solve the problem. So now we see that the president wants it to be undone, and the Republican majority in the two houses want it to be undone. So my guess is it will be undone. And so the question really is, why? Must have been wondering to you, is it that there's a principle that we shouldn't insure people? That it is somehow better to have millions of people with no medical insurance? Is this an ideological commitment? Is this a principle of some sort? There are some people who talk like that, but not many, not many. And so I don't think we have to go there in some obvious way to look for the answer. Well, is it then perhaps something else? Could it be that perhaps the big industrial combines, the medical industrial complex, got together and wants to undo this bill? And the answer is no, because they basically got the bill they like. With more people insured, that's more business for them, paid business. They weren't required to lower their costs, none of it. So there would be no reason for them to go on the warpath to undo this. They got pretty much what they wanted, which is no government restriction on how much they can charge us for medical care, medical insurance. Well, then what is the reason? The reason is simple. How was the extension of medical insurance in the United States, how was it paid for, especially the government's role in the exchanges, in subsidizing poor people and all of, how was it paid for those of you who don't know? It was paid for by two taxes, a 0.9% Medicare tax on earned income over $200,000 per individual or $250,000 per couple. And on top of that, a 3.8% net investment income tax on income from wealth. That is, money you get not from a wage or a salary where you're paid for your work, but rather income from wealth if you own stocks and bonds. You with me then? The cost of Medicare extension, of the Obamacare, was a tax on rich individuals, 0.9%, people who earn over $250,000 a year as a couple or $200,000 as an individual, and 3.8% on people who get income from wealth. And by the way, not all people, but only people who, again, have $250,000 or more. If you earn $100,000 and you have some stocks, you're not covered under this tax. You don't have to pay. In other words, folks, Obamacare was paid for by a tax on the rich, and that's why it has to go. You understand? The Republicans and Mr. Trump want to give to the rich the tax cut. He couldn't admittedly say, one of my first acts is to give rich people a tax cut. This doesn't sound good. So instead, he's getting rid of the medical thing that imposes on us the blah, 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 blah. But the issue is that Center on Budget and Policy Priorities, one of the most important government in Washington think tanks that produces really good stuff, which I use all the time, as many other economists do. They calculated millionaires will get 80% of the tax reduction that comes from not having Obamacare. Bingo. And if you want, you can see this at the end. You can just go to cbpp.org. cbpp.org. You get this document, and it has a wonderful set of charts showing that the people who will enjoy tax savings are the richest people in the United States. The top 1/10% with incomes above 3.8 million would receive tax cuts, if this repeal goes through, of $195,000 each. Are you ready? Because most Americans can't stand these numbers. And it's not because you don't get the numbers. It's because you don't want to see this. Because this is like a slap in your face while the person slapping you is giggling. Wealthy people in America are going to enjoy a $195,000 reduction in their taxes because there won't be Obamacare anymore. Meanwhile, the press will be telling you all about this or that detail of medical service that isn't good in this thing and that we can do better. Yeah, maybe, but that's got nothing to do with anything. As I tell you sometimes, it's hard to keep a straight face when I explain these things to you. And the only thing that I could do that would make it easier is if between my updates we all stopped and I just played the national anthem to underscore something. One of you asked me a couple of months ago, who are the people who earn the most money, the executives in the United States? And since we're on healthcare, I thought I'd answer it by letting you know the results of the most recent research done by the Bloomberg Financial Services people. So you can see it's not quite the political perspective that I would come from, but I'm using the numbers of people who see things differently. Okay, and this is for data as of December 31st, 2016. And they take where are the best paid executives? Where do they get their money? Okay, and there's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 industries. The 10 industries that pay their top executives the most. Okay? At the top of the list, if you can see the diagram where the orange line goes the furthest over, the ones who get the most, ready? Here we go. Health care. Health care. Let me do this again. Health care. The executives who get the most money, the $1 million and many millions of dollars a year, are in health care. So that you can have this comfort. Yes, you pay more for health care than any other people in any other advanced country. But don't think it goes to waste. It enables these people to be the highest paid executives in the United States, ahead of information technology, which is second, energy, which is third, financials, which is fourth, and consumer discretionary, which is fifth. But health care, you're all paying for health care. And you should feel very proud. The next time you see a very wealthy healthcare executive, remind him or her that it's all through the good graces of your willingness to pay.